Good afternoon, everyone who's joined us this afternoon for the International Symposium and Workshop hosted by ICMR on One Health in India, Research Informing Biosafety, Preparedness and Response. We thank you for everyone who's joined us from various parts of the world. Most of all, we are grateful to our Honorable Minister, Dr. Harshvardhan, for having spared us his valuable time to join us in this very important symposium and workshop. Thank you, sir, for joining us. May I now request Professor Dr. Balram Bhargav, Director General, Indian Council of Medical Research and Secretary, Department of Health Research, to welcome us and set us off on this afternoon's program. Dr. Bhargav.
Thank you. Thank you, Dr. John. Our Honorable Minister of Health, Government of India, Dr. Harshvardhan ji, my colleague secretaries, the Principal Scientific Advisor of the Prime Minister of India, Dr. Vijay Raghavan, distinguished scientists and illuminaries. The Second World War in the 20th century marked the discovery of penicillin, and we thought that we had won the war against the microbes. The later part of the century demonstrated the emergence of HIV, antimicrobial resistance, and drug resistance tuberculosis. This century, in its 20 years, has already witnessed SARS, MERS, Nipah, Zika, and we are all in the midst of the COVID war. These facts make the concept of One Health one of the most important weapons against the threats to lives on Earth. We would like to thank our Honorable Minister for announcing this high-level interministerial group for action on One Health. Thank you, sir. Today, we have participants from USA, UK, Europe, Russia, Japan, and Australia. These deliberations will pave the way for India being a major player in One Health in the world. One Health remains an important agenda, and we also thank the Minister for releasing the special issue of the Indian Journal of Medical Research on One Health, talking about policy as well as the changes that we can make for One Health agenda. Thank you so much, sir.
रंग जो भी हो, ढंग जो भी हो, रीत अपनी सदियों का सच है। ये दुनिया एक घर है, ये दुनिया एक घर है, ये दुनिया एक घर है, ये दुनिया एक घर है। मुश्किलों से हम मिलके लड़ लेंगे, काली रातों में तारे जड़ देंगे। साथ हो जो हम, फिर कहाँ डर है, फिर कहाँ डर है। ये दुनिया एक घर है, ये दुनिया एक घर है, ये दुनिया एक घर है, ये दुनिया एक घर है।
May I now invite our Honorable Minister for Health and Family Welfare, Dr. Harshvardhan, to very kindly release this special issue of the Indian Journal of Medical Research on One Health. Sir, the floor is yours. The audience is yours.
Professor K. Vijay Raghavan, Principal Scientific Advisor to the Prime Minister of India, who is gracing this occasion. Professor Dr. Balram Bhargav, Secretary, Department of Health Research and DG ICMR. And I can see that there are a lot of scientists who have senior ICMR scientists who have joined me virtually. Dr. Samiran Panda, Dr. Manju Rahi, Dr. Anju Sharma, Dr. Albina Nair, Dr. Anna Dogra Gupta, Dr. Bobby John, Director of Acuitas Consulting Agency. With me here in Nirman Bhavan is Mrs. Anu Nagar, Joint Secretary, Department of Health Research, Dr. Rajni Kant, Dr. Lokesh Sharma, and I understand that there are very senior officials, including Secretary, Department of Biotechnology, Dr. Renu Swarup, and others from the Ministry of Defense Research, Environment, Forest and Climate Change, Agriculture Research and Education, Animal Husbandry, Dairy and Fisheries, and also from the Department of Science and Technology. I understand that we have people from the Wellcome Trust, Professor Jeremy Farrar, and then very senior people who have joined us from various other countries like US, UK. I've been told that there are other doctors, scientists, academicians, and faculties from universities, and it's a big list of very distinguished people who have joined us in this very important international symposium, which is coming at a time, I think is the most appropriate time when the whole world is experiencing the COVID pandemic, and there can't be a more apt time of organizing this activity around World Health, this One Health. We already know that 64% of all those infectious diseases that emerged between 1973 and 1994, this is the data that I could have access to. They had etiology which was zoonotic in nature. And then out of the 1,415 infectious diseases that human beings suffer from, 61% are again zoonotic. And then out of the 177 infections which are supposed to be emerging or re-emerging, 73% are again zoonosis. And it has been, India is right now called as one of the 4 global hotspots where there is a increased emergence of, in fact, there's a huge risk for the emergence of infectious zoonotic diseases, drug resistant, and foodborne infections, etc. So, and the time that we are witnessing right now, still the most accepted theory is that probably a virus jumped from the animal kingdom to human being, and the COVID virus has caused so much of damage, so much of loss of life, so much of morbidity all over the world. We are still, even after almost 15 months, we are still struggling with COVID. And but the whole virus has once again, although in the last 2 decades, as Dr. Bhargav has mentioned, we could see many diseases which emerged like SARS and MERS and Ebola. We saw Zika and Nipah and many other diseases where there's a link with the animal kingdom also. But this virus, I think COVID has certainly been an experience, once in a lifetime sort of experience for every person working in the field of medicine, and especially for those who are researchers, who are epidemiologists, pathologists, clinicians. For everyone, this has been a very, very unique experience. And it's really heartening to learn that at this very important time in our nation's history, unfortunately, we are suffering, but we are very well conscious of the fact that we all have to be working together. This virus has taught the whole world that if you work together, and within the science also, if everybody is working with a good quality synergy, and within the systems also, if everybody is aligned towards a single goal, then we can certainly fight out many things in the ablest manner. So I'm very happy that a lot of national and international people, they have all relevant stakeholders have actually joined today for this international symposium. I wish to congratulate all of you. Friends, you all know that with the increased interaction between humans and animals, whether they are domestic and wild, and then of course influenced by climate change also, human health can't be seen in isolation. And as I said earlier, this present COVID-19 pandemic is more than a reminder of this fact. The present international symposium is focused on the One Health approach. And this One Health approach recognizes that the health of people is closely connected to the health of animals and our shared environment, and a lot of factors are to be understood as shaping the overall health landscape. For example, more people are today in closer and regular contact with wild and domestic animals, both livestock and pets. And this is both a result of human population growth as well as the expansion of human habitation into new geographic areas. There is significant increase in the human-animal interaction at the domestic level, particularly through the adoption of animals as pets. And those who are pet lovers like me, for them, the pets are like their own children, including otherwise these non-domesticated species also. Exotic food fetishes in many parts of the world and medicinal beliefs are also driving increased human entry into the animal space in the wild. Close contact with animals and their environments provides more opportunities for diseases to pass between animals and people. We all can appreciate that the earth has experienced a lot of changes in climate and land use, like deforestation and intensive farming practices, disruptions in environmental conditions and habitats. They can provide new opportunities for diseases to pass to animals. And I'm happy that this particular March issue of the Indian Journal of Medical Research is dedicated to discussing all this in great detail. The movement of people, animals, and animal products, this has increased, of course, from international travel and trade also. And as a result, and that we have seen during this COVID pandemic also, diseases can spread quickly across borders and around the globe, either unintentionally or otherwise. And we are all witness to the greatest example of this during our COVID pandemic. These changes have led to the spread of existing or known endemic and new or emerging zoonotic diseases, which are diseases we know that can spread between animals and people. More than half of all infections that people can get can be spread by animals. I had mentioned even the percentages in the beginning that are being recorded in the records. Each year around the world, it is estimated that zoonosis, the diseases which are shared between people and animals, they cause something like 2.5 billion cases of sickness and 2.7 million deaths. As the currently underway COVID-19 pandemic demonstrates to us, rapid spread of these novel pathogens can have significant impact on the global economy. The whole world has experienced this during 2020. We were fortunate to have a leader like Prime Minister Narendra Modi, who could handle the COVID and who could handle the economic crisis, who could strike a good quality balance between handling COVID and also taking care of the economy simultaneously. And now we, I think in India, are probably one of the, in spite of COVID, one of the better performing economies of the whole world. Preparedness for and mitigation of such events require a One Health approach. This is now well established. Time and again, it has been reminded to us by the emerging and the re-emerging infectious diseases and with biosafety protocols, threat characterization, and rapid response capabilities nested within an overall doctrine of health that is underpinned by wide-ranging and in-depth biomedical research capabilities. So in this context, I wish to place on record my greatest appreciation to once again be fortunate to have released this special issue of the Indian Journal of Medical Research focused on One Health being brought out today. I remember that last year, almost at the same time, the ICMR had given me the first edition that was released in 2020. And in the preface itself, there was a mention about the potential of, I think, at least a few million viruses which have the potential to, I think it was, if I correctly remember the figure, it was like 1.7 million or something, which have the potential to jump maybe accidentally from the animal kingdom to the human beings. So we can well imagine that when a single COVID virus can cause so much of havoc and devastation and loss of life and illness, and has literally shattered everything. Everything appears to be in shambles right now. And we really don't know how many waves of COVID we are going to see. So the very fact that right now everybody has once again appreciated the importance of bringing all the stakeholders working around all these areas on the one platform, and then a contribution from learned people, and then this compilation by the Indian Journal of Medical Research. I think this is very, very timely. So the focus is this focused activity around One Health, which has been brought out today. I think that's what I have really no words to express my gratitude to ICMR and also my appreciation to ICMR and for all those who have in fact contributed to this journal. I can see that every paper has so many wide-ranging references from literature also, and from most of the learned people from all across the globe. So I'm sure that this is going to add to the body of literature and also provide pointers to the most relevant issues that actually need further research today. And this is going to provide us a lot of guidance in shaping the One Health approaches in our country and of course across the world. I'm also pleased to announce the constitution of a high-level steering committee for eco-health initiatives in India. This committee will have its secretariat hosted at the ICMR headquarters in New Delhi, and will also be supported by the upcoming National Institute of One Health, which is coming up in Nagpur, and this is one of our is going to be one of our very premier institutions. One of the ambitious projects supported and guided by our own Prime Minister. Also, a mention of this was made even in the union budget, and this is one of the important components of the ambitious schemes around which the future health delivery systems in this country, whether for treating or whether for doing research or whether for diagnostics or whether for strengthening testing capabilities, and then for all those factors which have to be factored in now related to the transfer of or the travel of virus from the animal kingdom to the human being. So this National Institute of One Health, it has to play a very major role, and it's not only India, but of course I think everyone all across the world will look towards National Institute of One Health with a lot of expectations and hope. So I am also pleased and would love to acknowledge, I wish because of the mechanism through which we connect with each other these days, it's digital platform, and we really are not able to appreciate who has joined, who has not joined, and I wish I had acknowledged the presence of all of you, the great leaders, the great thought leaders of the whole world at today's symposium, at a personal level also. But I have to certainly thank all the thought leaders of the whole world, and of course India, who are present at today's symposium and this very, very important historic workshop. And it's my intense desire and hope also that this symposium, it will ultimately be recorded in history as a real good quality starting point for a broad-ranging multi-stakeholder discussion and collaboration to actually secure better health for all on this very beautiful planet we call home, and for which it is our solemn responsibility to protect it and help the mankind and human beings. And as health professionals and researchers, we have to take care of the health of millions of people on this planet, and we have to work with close collaboration and a state of synergy and dedication. And that's what I think our intention at organizing this international symposium is. So once again, I wish to express all my gratitude and appreciation to ICMR, Dr. Balram Bhargav, and all your colleagues and all other stakeholder ministries, all the senior people belonging to other ministries who have graced this occasion, and all the thought leaders from all across the world. Once again, for your esteemed participation in this particular activity, and I look forward to very useful deliberations, which will certainly guide us in a very, I would say, sophisticated manner, and in a very precise manner, in a very meticulous manner, about reshaping and redesigning our health policies for the future, keeping in view at the back of our mind this threat of zoonosis that has actually over the last few decades proved to be a real dangerous phenomenon for the whole world. And I'm sure that activities like this should prove to be a game changer for the healthcare delivery system of the whole world. So with these few words, I would like to close with the prayer, which is from our ancient scriptures. This is Sarve Bhavantu Sukhana, Sarve Santu Niramaya. And I'm sure we'll all be benefited by this international symposium. Wish you all good health, stay safe, and we look forward to the blessings of God to be able to fight COVID more effectively, efficiently, and score a decisive victory over COVID in the near future. Thank you so much.
Thank you very much, sir. Yes, sir. We're very grateful to have had the privilege of our Honorable Minister, Dr. Harshvardhan, address us and point us into the directions where we need to go. We do have a full program ahead, and without wasting time, may I invite the Principal Scientific Advisor to the Government of India, Dr. K. Vijay Raghavan, to briefly address us. Sir, the floor is yours.
Thank you, Dr. Bobby John. Honorable Minister for Health and Family Welfare, Dr. Harshvardhan, Director General of ICMR, Secretary Health Research, Dr. Balram Bhargav, Professor Ashutosh Sharma, Secretary Science and Technology, Professor Renu Swarup, Secretary Department of Biotechnology, Secretary Animal Husbandry and Development, Shri Atul Chaturvedi, Dr. Trilochan Mahapatra, and all the other guests assembled here. This is really a important occasion where we see ministries from science and technology, health research, environment and forest, animal husbandry, all coming together. And One Health is a topic which covers all of this. We need concepts like One Health today because we're now specialized, and it's a downside of specialization. Ancient systems of medicine and science, even recent science in the early 19th century, 20th century, always practiced One Health. One Health as a concept, while a very useful overarching one, requires specificity though to have real utility. Otherwise it runs the risk of other such broad concepts such as world peace, which are very good but difficult to achieve. How do we think of One Health, and how do we achieve a focused science on One Health? And I think the Indian Journal of Medical Research issue on that, which has come out, is a very important direction. We can think of One Health at different levels. Technologies, how can we make sure technologies developed for one sector are used in other sectors? For example, vaccine platforms, which we have seen today. Nutrition, how advances in animal nutrition, which has specialized well beyond human nutrition concepts, can inform human undernutrition challenges. Disease surveillance and control, and this is what most people think about when they think about One Health. But again, there are issues in animal health, livestock health, and human health, which are intertwined, and also agriculture and plant health and nutrition. In India, we have multiple One Health services, all independently being developed. Now, this is in itself not a bad thing. It can be made into a good thing. We would want all these groups to focus on areas relevant to their mandate, but also come together. So ICMR, the Health Ministry, addressing the human side, but working closely with animal husbandry, with ICAR, with environment and forest, and similarly, each one stressing on their strengths, but partnering together is the right way to do this. And the One Health Institute coming up in Nagpur is likely to be a very good place where all of this comes together. We need to make sure of two things going ahead, that these activities add up so that the whole is more than the sum of the parts, and that's a big challenge. And that's something which I'm sure that the collective leadership will address and take care. And we need clarity on how this will add up to a whole at the outset when we design these systems. There is also a need to make sure that what happens together nationally is linked to international structures, which also have this challenge that there are multiple structures for different aspects of international collaboration, but they too need to come together. For example, for vaccines today, we have CEPI and COVAX and Gavi. For animal health, we have other organizations which are there globally. For food and agriculture, we have similarly yet other organizations. So internationally, these also need to come together and partner with our national structures so that in the context of climate change, sustainable development, and challenges on biodiversity, we can have an overall 360-degree perspective. I'd like to end here and to say that I look forward very much how we can achieve this intersection and complementarity at both national and international levels. Thank you.
Dr. Vijay Raghavan, thank you so much for your cogent remarks. May I now invite Srimati Uma Devi, Additional Secretary in the Department of Environment, Forest and Climate Change, ma'am, for you to address this August gathering.
Yeah, thank you. Honorable Union Minister of Health and Family Welfare, Dr. Harshvardhan, Dr. Vijay Raghavan, Principal Scientific Advisor, Government of India, Professor Dr. Balram Bhargava, Secretary, Department of Health Research and Director General of Indian Council of Medical Research, Secretaries from Department of Defense Research, Department of Agriculture Research and Education, Department of Animal Husbandry, Dairy and Fisheries, Department of Biotechnology, Department of Science and Technology, dignitaries and experts from other countries, my friends and colleagues. A very good evening to all of you. It gives me immense pleasure to share my views in this international symposium and workshop on the subject One Health in India. The emergence of COVID-19 has emphasized the fact that unregulated exploitation of natural resources, coupled with unsustainable food habits and consumption patterns, leads to destruction of systems that support human life. Several studies, as rightly mentioned by our Honorable Minister, as well as the Principal Scientific Advisor, across the world have indicated the linkages between the destruction of ecosystems, changes in land use, leading to biodiversity loss, exposing the wild animals carrying zoonotic organisms to human populations, resulting in emergence of infectious diseases. This is the right time to devise a long-term strategy in a holistic and integrated and proactive manner through One Health initiative, taking into account the interconnections among the health of the animals, human beings and environment, and disease prevention and control measures. Therefore, I strongly believe that there is a need to strengthen integrated approaches for management of zoonotic diseases through multi-sectoral coordination of various departments like the Environment and Forest, the Wildlife Department, Animal Husbandry, Veterinary Departments, Public Health Departments, Department of Biotechnology, by proactive monitoring and putting surveillance mechanisms in place. As far as biosafety is concerned, I would like to inform this August gathering that India is a party to Cartagena Protocol on biosafety and is committed to its obligations. Genetically modified organisms and products thereof are regulated under the rules of 1989 for manufacture, use, import, export, and storage of hazardous microorganisms, genetically engineered organisms or cells, notified under the Environmental Protection Act of 1986. These rules cover the entire spectrum of activities relating to research, development, and use of genetically modified organisms and their products. Friends, I'm confident that this symposium will benefit in advancing the research on biosafety, preparedness, and response on One Health initiative in India. Thank you very much.
Ma'am, thank you very much for your remarks. May I now invite Dr. Trilochan Mahapatra, Secretary, Department of Agricultural Research and Education, to address the audience.
Thank you very much, Honorable Union Minister of Health and Family Welfare, Science and Technology, and Earth Sciences, Dr. Harshvardhanji, Dr. K. Vijayaraghavan, Principal Scientific Advisor, Government of India, Dr. Balram Bhargava, Secretary, Department of Health Research and DG ICMR. We have Dr. Asutosh Sharma, Secretary, DST, Dr. Renu Swarup, Department of Biotechnology, Sri Atul Chaturvedi, Secretary, Department of Animal Husbandry, Dairy and Fishery, and also others who are present today. Thanks to Dr. Balram Bhargava for inviting me for this particular inaugural session. One Health is globally recognized as a kind of program which envisages to deal with problems connected with not just human health, but also it goes beyond these sectors. And also it deals with issues not only zoonosis, the zoonotic diseases, as it was rightly said, the antimicrobial resistance, vector-borne diseases, food safety, as well as environmental issues, particularly the contamination. So given the importance, rightly, that this is the most opportune moment, given the threats of COVID to the very civilization existence globally, So this is the right time that the Department of Health Research has brought everybody concerned on a single platform to this deliberate and plan future course of action. Particularly thanks to Honorable Minister, not only for release of the One Health special issue, but actually bringing forth several views and critical points for our consideration. The Indian Council of Agriculture Research recognized the importance of genetic diseases 5 decades ago. In fact, worked on most of those which are concerning the animal health in the country. They developed not only the diagnostic for each one of them, also developed vaccines. For instance, the recent the avian influenza, the samples which were collected from 14 states, they were analyzed in our high security disease lab in Bhopal. And similarly, the vaccine development for 8 to 9 different genetic diseases, we have developed a vaccine. And the most recent one is with the support of biotechnology, thanks to Dr. Renu Swarup, we developed a vaccine for brucellosis, which is a very serious genetic disease. And we have also together commercialized this for large-scale production and supply. Similarly, there are various aspects of the issues concerning One Health, starting from soil ecosystem to plant and then animal to human. As a continuum, and we are actually trying to work on each one of these aspects as our mandate. Also building capacity. So we have veterinary public health being taught for more than 50 years in 54 different veterinary universities as well as our deemed universities, and building human resource for the purpose of dealing with the problems which are faced at the animal, in the animals sector. Similarly, the pesticide residues which are dealing with the food safety and environmental contamination, their mega program which is actually being catering to the needs of this sector. Certainly in the context of newer challenges due to climate change, there are essential needs as highlighted by both Honorable Minister and also Honorable Principal Scientific Advisor. Most importantly, there is a need for mega global networks so that we are working in a unified manner for all sectors coming together and in a multidisciplinary mode to understand the issues, particularly the human-animal interfaces, which are not very clearly understood. And similarly, there is a need, and the National Institute of One Health is being established, but the infrastructure which are dealing with addressing the needs of genetic diseases particularly, they are very old. I think there is a need to really look at holistically so that there are more BSL-4 labs established to deal with such life-threatening diseases, particularly genetic diseases. Capacity building is very, very important, and certainly investment is important. And since the cross-border, the cross-boundary problems are there, so probably at international level, we have to really discuss and deal with this. The Indian condition with high human population and animal population being also huge. So there is a spillover effect from animal to human and human to animal. And these need to be really dealt with very seriously. And we are working on antimicrobial resistance through our own internal network. But there's a need to really strengthen these activities, as we go along. And this particular workshop, providing that kind of impetus to the programs which are being carried out at different organizations, which are brought together in some fashion or other, so that they are further strengthened. The COVID, we have tested more than 5 lakh samples, but it's not just one aspect of it. There are many other aspects which we can deal with, and I have also written about it. But I'm sure once these are deliberated with open mind, there could be many more things coming out, and our programs at the national level are further strengthened to deliver at the right time. the products which are so essential. So with these words, once again, thanks and best wishes to the program.
Thank you, Dr. Mahapatra. May I invite Mr. Atul Chaturvedi, Secretary, Department of Animal Husbandry and Dairy, to address us.
Thank you, Honorable Minister for Health and Family Welfare, and Dr. Balram Bhargav, the coordinator and the organizer of the event, Professor Vijay Raghavan sir, Principal Scientific Advisor, Secretary DBT, Secretary DG, Secretary and DG ICR, Secretary DST, and other senior officials and distinguished participants. As already highlighted by the Honorable Minister, the role of animals in pandemic is now a well-known statistic that has been stated repeatedly in various forums. In fact, the role of domestic animal is critical and needs to be appreciated, especially with reference to disease outbreaks in animals, which are not just important because they can be transmitted to human, but they have a crippling effect on our economy, which in turn affects every aspect of our society. Socioeconomic losses from zoonosis are difficult to quantify completely because of complex impacts, including loss of work capacity and income, clinical complications and their management, social interferences and potential malnutrition, besides direct costs for disease management, be it preventive, therapeutic, or other health services, that is hospital diagnostic and laboratory services. The loss of human efficiencies and man-hours, together with medical costs of control in zoonotic diseases, affect the national economy severely. Zoonosis also undermines animal health and productivity, reducing the production of food, that is meat, milk, egg, and wool, as well as the work output, which contributes to human malnutrition and to lowering the resistance of the large number of people. The economic cost incurred in the control of zoonotic diseases in animals are often huge and are additional to the medical cost and losses in human work. The additional expenses arises from surveillance mechanism for detecting animal reservoirs, diagnosis of animal diseases, quarantine of animals, restrictions on animal transport, inspection of meat and milk, and contamination of animal products. The impairment of animal production by disease forced many countries to import milk, meat, leather, wool, and other animal products. The ban for air travel has severe repercussions on tourism industry. So all this put together has huge impact if we start analyzing the impact. The pandemic risk is multiplying rapidly due to global trends and anthropogenic change, including deforestation and increased livestock production. With a growing population and increased demand for animal protein, there is an urgent need to produce more food. Yet, rapid expansion of livestock farming, agriculture, intensification, and subsequent wildlife habitat encroachment are creating system of potential spillover of pathogens from wildlife to livestock and human. As such, a strong prevention, surveillance, and response capacity in animal health sector that works in harmony with human and environment health sector is a prerequisite and a cost-effective way to prevent the emergence and spread of zoonotic diseases that have significant public health consequences. By managing animals effectively, we can address zoonotic diseases emergence at its source and increase the rapid and effective detection, prevention, and response efforts of all relevant sectors. This One Health approach allows for a comprehensive effort which leverages the activities and efforts of human, animal, and environment health sectors to respond to pandemic disease threats. Operationalizing a One Health approach requires leveraging the cooperation and strength of diverse sectors, both in public and private, including livestock health, human health, wildlife health, environmental health, technology, and finance to develop solutions to these local, national, and global health challenges. Given the transboundary nature of emerging zoonotic diseases, efforts cannot be limited to a state-wide response, but needs to be extended to the entire region. A number of different initiatives from various ministries and departments have been witnessed lately. There is a serious need to address these issues at the source of the disease transmission, that is in the animals and animal system. The One Health approach should include a focus on role of animals in addressing pressing challenges related to zoonotic diseases, emergence, and spread. We at the Department of Animal Husbandry and Dairying have been working on establishing a national disease surveillance network through National Digital Livestock Mission. However, this cannot be expected to solve all the linkages to human if we do not work together. Serious resources allocated to strengthen this and link the information to human spread as well as connected with the wildlife reservoirs. My message and request is that instead of initiative becoming One Health and many voices, Let us make this a genuine collaborative effort and let us leave behind an integrated disease control program for the country. Thank you very much.
Thank you, sir, for your remarks. May I invite Professor Dr. Renu Swarup, Secretary, Department of Biotechnology, to address us now.
Thank you very much for this opportunity. Honorable Minister, sir, Dr. Balram Bhargav, Dr. Vijay Raghavan, in fact, Dr. Jeremy Farrar is here. Welcome, Jeremy, for this very important meeting. Secretary DST, Secretary Animal Husbandry, DG ICR, all other colleagues. It's a pleasure to be here today for this meeting, and compliments to Dr. Bhargav for putting this together and getting all of us onto a common platform to discuss this very important subject. And the importance of One Health, as has been outlined by the Honorable Minister in his opening remarks and by all the previous speakers. It's been so well recognized, and the need for taking this up in a transdisciplinary, collaborative manner is so important, being multi-sectoral as it is, and the complexity of the issue and the way it needs to be handled, bringing in all stakeholders to see how we can take this forward. The journal, of course, is excellent because this brings in not just the contributors to put in their papers, but also to discuss the key issues, which will then bring in the convergence of minds to be able to deliver a common roadmap as we move forward. In India, we've been looking at the whole One Health issue and, of course, the related AMR issue in particular in a very in a significant manner. And in fact, the National Action Plan for AMR was outlined a couple of years back, with each of the verticals being taken on by different groups and responsibilities on how we would handle this. And the Department of Biotechnology is one of the important stakeholders who's been working on the research, development, innovation vertical and trying to see how we bring in new technologies and solutions which can then feed into this larger program that is being talked about. Never before would there be a time when we can sit and understand the importance of this than today. The pandemic itself has brought to us what the key concerns are and how this whole issue of One Health, especially the zoonotic diseases, needs to be addressed. DBT had worked very closely with all partners within the government, with all our ministries, but with WHO, with the Gates Foundation, and with many others when we organized the last meeting in 2019, which was mainly to develop a roadmap for this One Health, and that was the One Health India conference that we did in 2019, and we had all the stakeholders who are there as a part of it, and the then Secretary Animal Husbandry had actually put in their main activity to take forward. And I'm glad that at that point of time, working with you, we had launched the larger brucellosis-free village program, and we had also taken up a major initiative on the bovine tuberculosis. And I can see, I think I saw Vivek Kapoor's name somewhere in the grid. That is a major initiative that we took on based on that. As a follow-up of that, we had also set up this One Health regional expert group, which then I think it was last in June 2019, and following it up in 2020, they had series of consultations with all the members sitting here, and the One Health Center was established. And that One Health Center, which today is housed at the National Institute of Animal Biotechnology in Hyderabad, which is a center in the Northeast in the institute there. And we have, in fact, 27 institutes, and I'm very pleased to see that we have all the organizations there, ICMR, ICR, Animal Husbandry, state veterinary departments, and many others. So that's again a very excellent platform where they're looking at different components of it, whether it's looking at the diagnostics that we provide to facilitate the surveillance part of it, or bringing in the repository where you can bring in the database. Also looking at platform technologies such as monoclonals and others, which could be important as we move forward, because those are key aspects that we're trying to put in. And also through the Northeast Center, we've been able to bring in some of the best veterinary laboratories and others who have become part of this network. So I think the point that I was trying to mention is that we do have some strengths which exist, but I think Today is the need for us to all bring this together through this common platform which is being discussed, so that we have, like we've done the National Action Plan for Antimicrobial Resistance, the National Action Plan for One Health, so that there is a common approach. Today, we've all seen at COVID times that each department, with the strength that they had, came together and collectively, with a collective ownership, we responded in such a wonderful manner to be able to deliver. That's really what is now the need for this One Health approach. We don't need a pandemic like COVID to pull us out of our comfort zones and come together to work together. And I think we know that One Health and AMR is probably today as important as the way we are addressing issues related to COVID. The Department of Biotechnology, which is also the nodal ministry for all biosafety and biosecurity related issues, through the rules which were talked about by my colleague from Environment Ministry, has been facilitating this whole process. And we have now very recently brought out the guidelines for the BSL2, BSL3, and now we will be putting that for the BSL4 to ensure that all BSL2, 3 facilities which are there in the country go through a certification and an auditing process which the regulatory requirements mandate, to ensure that there is a quality that we bring into it. So that's again one step in trying to bring in this quality. We've also proposed a biosafety, biosecurity network of laboratories, and in the last recombinant DNA advisory committee of the country, which is again one of the statutory bodies, this network is again looking at the gaps which exist so that we can set up more such either bring forth those facilities which exist, or if required, look in for the need for BSL4, etc. So I think all that I would like to conclude by saying is a lot of effort is being made by different stakeholders, different bodies. It's also important to bring on board here that this truly has now taken shape of a public-private partnership. We've got industries who've come on board, we've got all stakeholders and the international organizations. And this is now ready to take off as one of the large networks. The point about which we have taken up in the COVID about the molecular surveillance, being connected with the epidemiological surveillance, it holds so true for activities and programs that we look within the One Health approach. So whether it's plants, whether it's humans, whether it's environment, because we've been looking at that again in a big way. I think this is really the platform that has to come together, and we look forward to this roadmap which will come out at the end of the day, because these transboundary, multifactorial, different complex issues can only be addressed with clarity of thought as to what is the roadmap and what is the role that each organization will play. So congratulations once again, and look forward to working with all of you to take this forward. Thank you so much. Over to you.
Thank you, ma'am, for your remarks. May I request Professor Ashutosh Sharma, Secretary, Department of Science and Technology, to make his remarks now.
Namaskar, Honorable Minister Dr. Harshvardhan ji, Principal Scientific Advisor Professor Vijay Raghavan, Professor Balram Bhargav, Secretary, Department of Health Research, and all the other colleagues who have joined us, clearly proves that we are talking about One Health. So even though this looks like a very diverse group, clearly our focus, all of us, are so tightly focused on the concept of One Health. Now, of course, even though we call it One Health, it is really multidimensional. And these multiple streams coming together is what makes for One Health. And the Department of Science and Technology has been doing a whole lot of these things in a holistic way. So very quickly, of course, the world has been shrinking because of technology, because of travel, because of digital aspects, and in fact, because of other aspects like climate. So there is one climate, one world, so clearly there has to be one health. If you look at economies are so entangled, we look at supply lines, we look at any of that technology, for example. So everything is one world, and therefore it makes sense that we talk about One Health. But One Health can be viewed from different perspectives. One of which is, of course, that one virus for one globe, and that we have already learned that one virus is common to the entire world, and which is one sense of One Health, global health, if you would. The other sense is that in order to have One Health, holistic health, we need at least 3 different compartments working together. And this is another compelling lesson of COVID-19 times. that all the products and technologies and the solutions that came with the speed, scale, and accuracy during COVID-19 times were made possible because of what people call triple helix working together, which is the industry startups on one side, academia, R&D labs, the knowledge producers on another corner of the triangle, and the government. And indeed, if we had a shared purpose, we had a shared vision, this is what makes it possible for three of these to come together spontaneously. And we may add to that the fourth corner, which is the international cooperation. And a whole lot of that happened also with great speed. Another way to look at One Health would be a holistic sense of health. And what does it mean? That it's not only a crisis management, but two aspects, which is to the sense, the health as a well-being, and also preparing ourselves for the next crisis which may come around. The BSL facilities, for example, they were woefully inadequate when the virus actually came along. DST has sanctioned setting up 10 BSL-3 and BSL-4 facilities, not only for health research. Of course, health research is very important. At the same time, related to health. For example, even today, we don't know what really is the effect of temperature on virus. What are the real pathways of transmission for different kind of mutations? Is there a change in these pathways? A whole lot of that stuff. So basic sciences are very important that we need to set up a very strong foundation of. At the same time, the translational aspects which are related to startups. During this time, we identified over 100 startups that could be ready with products and technologies and solutions, and they were totally funded. Very happy that they could actually deliver a whole lot of solutions during this time, despite many constraints. Another way to look at well-being is a program, for example, in science and technology of yoga and meditation. Now, of course, immune system is not immune to what we do with our life and our lifestyle choices. And all of that is of a very long-term interest, indeed, as to what kind of practices, whether traditional or modern, can be scientifically tested, put on a firm footing about what helps and indeed what does not help. So in terms of holistic health, One Health, another aspect is, of course, getting all kind of biomedical devices. And I know Dr. Balram Bhargav has been a big champion of this kind of stuff, which is integrates the clinicians, the scientists, and the industry and startups all together. Basically, invention and innovation ecosystems working together for health. And those are very good models that we need to take forward. And finally, I would conclude by saying, of course, let's take the case of pandemic. We need predictive models. So what is called the mathematical models. And at the point when the virus came in, there was no predictive tools at all. Now we have started, in fact, a sustained effort, because it cannot be a one-time effort. We need to have all the infrastructure and human resources in place before the next crisis turns up, because it is on these foundations that we build our response to a crisis. So a center for mathematical modeling, for example, that brings in the best of mathematics minds together in order to be able to tell this. And this is going to remain useful for all the future to actually come. And finally, that we have to integrate in our analysis of One Health, all the proximal areas. Climate change, for example, was being talked about. There are two large national missions on climate change in which health is being integrated, biomedical devices, artificial intelligence, machine learning, digital One Health, what have you. So basic point is that health actually ought not to be treated as a vertical anymore. Okay, so I would conclude there. What it means is that the health actually gets integrated in all the activities, in all the sectors that we do. So health, in a sense, is like science and technology. It is not a vertical, and it's got multidimensional aspects, even though we insist on calling it One Health. And the real creativity is in synthesizing and integrating all these different streams of knowledge, all these streams of action to point towards One Health. Thank you very much.
Thank you, Professor Ashutosh, for those remarks and for reminding us that One Health is not a vertical. And with that, we pivot to global speakers who are here to share with us from their experience and from their perspectives. But as we pivot to our presenters, may I remind those of you who have joined us via the public link that you are able to input your comments and your questions into the chat box that's there in the public channel. Please do so, time permitting, and we are running slightly behind schedule. Time permitting, we will be able to pick up a couple of your questions and channel them back to our presenters. Without further ado, may I introduce Professor Jeremy Farrar, CEO, Wellcome Trust, who has been waiting patiently and has joined in from London. Professor Farrar, the floor is yours. We are eager to hear from you.
Thank you very much indeed. And just checking you can hear as I come across. It's been a pleasure to join, and Honourable Minister, thank you for your introductory remarks, and many distinguished colleagues. Just to say at the start, it's been a great pleasure over many years now to work in close partnership and collaboration with many colleagues on this call. DBT India Alliance, of course, India was a crucial early partner in the foundation of CEPI. We work very closely with the heads of international research organizations from around the world, ICMR, and many others. So it's a pleasure to join you all. But my comments are going to be from a global perspective rather than insights, of course, into the situation in India itself. And I hope that's of some interest, a personal view of where things are. I think what you're planning to do in terms of the new institutes and the new coming together is very impressive. I'd like to put the comments in the context really not just of COVID, but actually of the last 21 years. And for me, this issue of emerging infections really started in 1999 with the Nipah outbreak in Malaysia, which of course has also troubled India and the subcontinent of South Asia. Nipah, SARS, MERS, Zika, Ebola, SARS-2, of course, the pandemic of H1N1, the bird flu of H5N1, but of course before that, of course, HIV, and as has been mentioned, animal infections, vector-borne diseases, dengue, chikungunya, Japanese encephalitis, and of course, drug resistance. These have been a constant theme of the last 25 years. And the drivers of all of those, in my view, are drivers which will be key drivers of the 21st century. They're not going to go away. They are in different ways and in different impacts: ecology, the changing environment, land use change, climate change, biodiversity loss, urbanization, animal-human interfaces, whether domestic or wild animals, and of course, trade and travel, making things all transnational, transregional, and intercontinental. And as a result of those drivers, which are not going to go away, they're going to increase actually in the 21st century, then the last 20 years should be seen, in my view, as what we can expect in the 21st century. And it should have really come as no surprise that something like COVID came to haunt the last 15 months or so. These epidemics are going to become more frequent, and they're going to become more complex. More complex because of urbanization, trade and travel, more frequent because of the drivers of ecological and other activities which are providing the perfect environment for which these epidemics can occur. And when epidemics occur, they, in my view, cause 4 interlocking circles, which is why the comments about the vertical nature of health are so well taken. The first circle in the middle is, in fact, in some ways the smallest. That is the direct consequences of the epidemic itself, the direct health consequences. The second circle, which is bigger, is the indirect health consequences. In every country in the world, it has the COVID issue has disrupted all other healthcare. Childhood vaccinations, maternal health, mental health, cardiovascular disease, oncology, diabetes care, tuberculosis, every other aspect of health has been disrupted over the last 15 months. The third circle is the economic impact, the trust in governments, education, trade, travel, remittances, country and national international debt. The economics impact will be profound and will take a long time to recover, hence a bigger third circle. And the fourth circle, which I think has also played a significant role, is geopolitics. It is, I think, the pandemic has been worsened by geopolitics. We're seeing that now with vaccine access and the inequity of vaccine access, but also at the east-west, north-south tensions that have allowed to be increased, particularly in the first 3 or 4 months of 2020, when some countries sought to blame others rather than the world coming together. And the interventions that we need in this One Health agenda, particularly around epidemic diseases, don't have natural market forces that can drive the basic science through innovation into commercial enterprises, products, or non-pharmacological interventions, whether diagnostics, treatment, or vaccines, or indeed PPE and oxygen supply and health systems. These cannot, in my view, just be left to the private sector. The private sector's got an absolutely critical role, but unless we change the incentives, and this applies to drug resistance as well, unless we work out a different mechanism, then the crucial public needs for public health will not be made, because the commercial models will not make vaccines, treatment, diagnostics for epidemic diseases, for diseases which may never happen. At some point, we need to appreciate that this is a public responsibility to make sure that the risk and the threat is diminished and the vulnerabilities of the world to these key drivers, which may be rare, but they will certainly happen, are supplied by both the academic, the public, and indeed the private sector. I think we've put efficiency over resilience in our systems, particularly in the health system, but actually in many other aspects. Most systems in the world now are driven by efficiency, next day deliveries, and are working at very close or totally at 100 or above 100% efficiency at all time. There is very little resilience in any of the system. There is very little surge capacity, and I think we will have to relook at that. On the continuum of One Health, I thought the comments by the Principal Scientific Advisor were very wisely made, and that is what we must do is bring interdisciplinarity to bear on these challenges. They are by their very nature interdisciplinary, between the animal, the human sector, between social sciences and biomedical sciences, between innovation, commercialization, and all of the aspects that are required in order to make a success of this. But what we shouldn't be is too bland and too broad that interdisciplinarity is an excuse for inaction. And there is often, I'm afraid, the threat that when we talk about interdisciplinarity, we spend more time talking about it than making it a reality. We have to understand the animal side and indeed plant side of pathogens, but the surveillance in that part must also lead into the human-animal interface. It is at that human-animal and indeed plant interface where these zoonotic infections are going to bounce back and forth between animals and humans until maybe an animal virus gains through evolution the ability to get a foothold in humanity and then indeed transmit between people. So that human-animal interface is absolutely crucial. And we need to understand that across the spectrum of disease. We need to be aware of clusters that develop, and we need to make sure that clinical medicine, whether animal or human clinical medicine, and public health are interlinked. I remember giving a talk some 10 years ago now to say that I thought that public health and clinical medicine had now been divorced for too long, and we needed to bring them back together again. And I still believe that to be true. We should not also ignore the importance of astute clinicians identifying something changing, often in critical care facilities, and feeding that into public health and the public health interventions. So we must try and not only bring the human and animal sector together, but we must try and bring clinical medicine and public health together in a different way. We need to find a route for a non-linear relationship between basic science, the clinical public health, the translation, the innovation, and yes, the commercialization of those so that we actually have the products produced at scale and capable of being distributed. And I'm afraid if we have fragmented systems, whether in government, and as I strongly comment, this is not related to knowledge or insight into the Indian situation, but this is a more global view. If you have fragmentation between human and animal sector, between ministries within government, between elements of the response, if that is fragmented in peacetime, you will never be able to bring it together in a crisis. You must have, in my view, these systems working in peacetime, be able to respond in a crisis. And don't try and create those relationships, partnerships, interactions, contracts between organization, administration. Don't try and create those de novo in a crisis, because you'll always be too slow. And as every country has shown, if you don't act quickly in a crisis, you will get behind the epidemic curve and you'll never, ever be able to catch up until, tragically, too many people have been ill and too many people have died. I think this is a particular challenge in countries, and I look here at the US and I look here to some degree at Germany and to an extent the UK as well, where there's a challenge of the responsibilities between a federal system and the state system. I think that introduces additional challenges to work in a complex environment when things are by their very nature national or regional or indeed global. I think too many countries have had what I call the complacency of exceptionalism, or maybe, and again, this is a comment globally, not to any particular country, or the arrogance of exceptionalism, the sense that we're somehow different, that this won't affect us like it affects others. And I'm afraid there has not been enough lessons and learnings across nations as well as within them. And too much often in many countries, and I speak here of my own as well, where I am at the moment in the UK, in terms of the complacency of exceptionalism. People have been too slow to respond. The scientific advice has not been filtered well enough and put into government policy making. And the last thing I'd say is, after a crisis like this, which is something that none of us at this scale have lived through before, we must be really honest about the weaknesses, the fragmentation, and the reforms that are necessary. I do worry that there'll be a political desire to move on from a crisis like this too quickly. There'll be a desire to say, actually, it wasn't as bad as it could have been. And I'm afraid the question is whether we will have the courage and the commitment to actually honestly ask what worked, what didn't work, and what do we need to make sure we have in place in order to both prevent and respond better the next time when this inevitably will happen, and use that in a way to reform our other systems so that they are fit for purpose, whether there's an epidemic or not, and we improve the health sector and in association with that, the rest of societies, in order to provide that horizontal flow. So I'm going to finish there. It's a great pleasure to join you as always, and I look forward to future partnerships with the many, many friends on this call and beyond. Thank you very much for the invitation.
Professor Farrar, thank you so much. There's so many nuggets that are packed into those last 10 minutes or so. I just want to pick two things and restate them or underscore them. One is fragmentation in peacetime will reflect itself pretty badly in times of crisis, and that's something that's worth noting for ourselves and underscoring for our future course of action. And the other one, I want to paraphrase from what Professor Farrar said. He said efficiency over resilience, and there's very little surge capacity. I want to pack that with what he had mentioned as arrogance, and I want to put them together, saying arrogance of efficiency is something that we are right now witnessing over multiple jurisdictions, and that's kind of leading us to certain hard questions. Thank you, Professor Farrar. For those of you that have joined us on the public view, your questions on the chat box, and if we have time, we'll come back to posing them to the various speakers that we have. Next up, we have Dr. Casey Barton-Berwish, Director of One Health at the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control in Atlanta. Early morning there for you. Thank you, Dr. Casey, for joining us. The time and the floor is yours.
Sure. Thank you, honorable ministers, secretaries, colleagues in India, and colleagues around the world. It's a pleasure to be here to talk with you this morning. I'm going to focus in a little bit on the One Health needs around zoonotic diseases, as well as global partnerships. And I'll start off saying that the health of people is connected to the health of animals, plants, and our shared environment. And we've heard this theme throughout the morning. And it's important to think about the different types of animals and the different types of interactions we have with them, whether it's for food or fiber, for companionship, sport, entertainment, working animals in airports. There's a lot of close connections, and animals play a really important role in our lives. And with that, the One Health approach is critically important because unfortunately, sometimes diseases can spread between animals and people, resulting in zoonotic infections. And it's important to have people who work to protect human health, animal health, and environmental health, and other relevant partners coming together to coordinate, to collaborate, and communicate, all with the ultimate goal of achieving the best possible health outcomes for people, animals, plants, and our shared environment. And we've heard comments around the importance of both endemic and emerging zoonotic diseases as threats to health security, with some of the information shared around 6 in 10 known human infectious diseases are zoonotic. About 3 in 4 emerging infectious diseases in people have an animal origin. 3 out of every 5 new human diseases that appear each year come from an animal, and 8 in 10 agents with potential bioterrorist use are zoonotic pathogens. When talking about One Health, it's very important to have a common definition so all relevant partners can be on board. It's different sectors have different languages, and the same words might mean something different in animal health than it does in public health. So it's really important to have that common foundation and to have a common definition. In the United States, our definition of One Health is that One Health is the collaborative effort of multiple disciplines and sectors with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and our shared environment. And we also note that this applies to working locally, nationally, regionally, and globally. And I always say One Health is a team sport and partnerships are key. There's no single person, organization, or sector that can advance One Health alone. And we really must work together. That includes subnational governments, national governments, regional partnerships, non-governmental organizations, international organizations like the Tripartite and the UN Environmental Program, industry, academic partners, and like we just heard from Professor Farrar, also bridging human healthcare providers and even veterinarians with public health being very important. So I want to share a few highlights from CDC's One Health Office, where we've been established for about 11 years, and we were the first federal agency in the US to stand up such an office. So we can lead CDC's One Health efforts in the US as well as around the world. We coordinate very closely with US government partners to address One Health, so we can strengthen One Health in the United States. We also advance One Health globally through the development of tools and trainings for capacity building in line with global health security. We leverage expertise across our agency and engage partners to tackle One Health issues. We create, strengthen, and optimize partnerships, including key human health, veterinary and animal health, and environmental health organizations and agencies. We provide human-animal environment interface expertise during outbreaks and public health emergencies. We respond to public health emergencies as well that require a One Health approach. That includes COVID-19, Ebola, natural disasters like hurricanes, and more. And we also fill a void on the control and prevention of pet-associated zoonoses to best protect health. We work globally as well. We are working with 25 different countries, and we partner with key international organizations. So one way we partner is through hosting loaned experts. We have a CDC loaned expert who sits in Rome, Italy, working with the Food and Agricultural Organization of the United Nations. We also have a CDC One Health liaison to the World Organization for Animal Health, and that's been really important. Within the US, we have liaisons such as a One Health liaison from our US Department of Agriculture, who sits within the One Health office at CDC and helps to coordinate between CDC and USDA on needed activities for our US relevant work. And those types of liaisons and sharing have been really critical and important for partnerships. We also serve as a head of an OIE collaborating center for emerging and re-emerging zoonotic diseases. And this has allowed us to partner with international organizations as well as with global partners to address emerging and re-emerging zoonotic diseases. And then I also want to share a process that we developed here at CDC that's been done in multiple regions around the world, including at the subnational level, the national level, and the regional level. And that's what we call our One Health Zoonotic Disease Prioritization Process. This is a collaborative process for bringing together key partners from a jurisdiction such as the national level from all relevant sectors to use a One Health approach to come up with their top priority zoonotic diseases, both endemic and emerging, of greatest national concern that they want to address using a One Health approach. They make action plans to address those newly prioritized zoonotic diseases. Those can be linked in with national action plans for health security, for example, and it really helps to get everyone on the same page in terms of having shared priorities and a shared plan and a shared vision across all those different relevant sectors. And we've seen some real trends in this around the world. Some of our most commonly prioritized zoonotic diseases include rabies, zoonotic influenza viruses, viral hemorrhagic fevers, anthrax, and brucellosis. And we also see some common themes in terms of the action plans that are needed, creating and strengthening One Health coordination mechanisms or platforms, improving outbreak response and surveillance capacity, improving data and information sharing across sectors, enhancing laboratory capacity, strengthening the One Health workforce, doing joint trainings across sectors on One Health issues. And those have been some important themes that we have seen throughout the course of that. Also, we're proud to be one of the partners who've worked with the tripartite organizations in creating a guidance document taking a multi-sectoral One Health approach, a tripartite guide to addressing zoonotic diseases in countries, or the Tripartite Zoonoses Guide for short. This has been a big effort between the World Health Organization, FAO, and OIE, and it provides guidance and operational tools to build national capacities in 8 different technical areas, and their One Health tools being developed around One Health coordination mechanisms, around joint risk assessment, and around surveillance and information sharing that countries can really take and use to help build those partnerships and trusted relationships during peacetime and get better prepared for whatever the next emergency might hit. And this is available in the 6 UN languages as well. So in terms of future One Health needs, we really need to increase and effectively leverage leadership engagement to support One Health. We need to create formalized One Health coordination mechanisms that can be at the national as well as the regional levels to have those joint priorities and shared action plans that could be done through developing a One Health framework that involves all relevant sectors. We know that enhancing surveillance through improved data and information sharing across all relevant sectors is also critically important. There's some great examples of surveillance systems that collect information on people, on animals, and environmental samples or food samples that are linked in with antimicrobial resistance testing as an example. It's also important to develop and strengthen laboratory capacity across sectors, being able to rule out those common diseases to help recognize when an emerging disease might be occurring is important. Applying a One Health approach to pandemic preparedness and planning is also highly relevant, as has been evidenced with the COVID-19 pandemic. Suggesting and conducting joint risk assessments for shared health threats, so all relevant sectors can come together and share information on human health, domestic animals, wildlife health, and the environment, and doing that joint risk assessment to help inform those plans. Strengthening the One Health workforce and conducting cross-sectoral training, increasing education and awareness through coordinated messaging is also key. And then using all of this to help identify research gaps and needs using a One Health approach. So I just want to close with saying One Health is the way forward to best protect health for all, and the effective mitigation of the impact of shared health threats at the human, animal, plant, environment interface requires strong One Health collaboration and partnerships, and allows us to have the biggest impact on improving health outcomes for people, animals, plants, in our shared environment. Thank you very much.
Dr. Batawish, thank you so much for that last bit where you've re-emphasized that unless we work together, we don't have our best bet together for global health. Thank you so much for your time. May I now invite Dr. Aubrey Miller from the Office of the Director, where he is a supervisor and senior medical advisor at the National Institute for Environmental Health Sciences at the NIH. Dr. Miller, the floor is yours.
Yes, thank you. Can you hear me okay? Okay, great. And I had some slides. If Dr. Bobby could put those up for me. First up, I'd like to thank the minister and my esteemed colleagues. Thank you so much. I'm going to reflect today a few minutes about the fact that we've spent a lot of time and energy building a framework for emergency management and response, but not so much the framework for collection of the scientific and research information necessary to be able to respond effectively, both at a national and global level. If I can go to the next slide, please. So I'm going to reflect a bit about this particular issue from our disasters bring new questions that demand research, as we've discussed this morning. Clearly, the COVID response in the midst of all these other disasters have been occurring this particular year, especially the wildfires and hurricanes in the United States, and thinking about how do we more effectively collect the information strategically moving forward. If I can move to the next slide, please. The Sendai framework certainly sets out an opportunity for us to think about this. There's also been a number of calls since 2010 across the United States in documents and literature with respect to the ability to collect information more functionally, more effectively, more efficiently. Certainly in the Sendai framework, they certainly illustrate the need for a One Health type of approach, an identification of vital health indicators of temporality, attribution, baselines, hazard classification, which allows for standardized taxonomies, as our colleagues from CDC and Dr. Farrar mentioned, the ability to interchange and integrate information across different types of disciplines, as well as the thresholds which would trigger larger scale responses from the local to national to international. Go to the next slide, please. In the United States, recently, we've been working on an interagency federal group to develop essentially a framework, kind of similar to the framework that the Sendai would lay out, which is really one of a One Health framework to integrate the human, animal, and environmental systems and agendas for biological incidents, including pandemics, accidents, and intentional releases. So really a focus of bringing the multidisciplines into a new framework to allow us to think about what information to collect. So this is really about identifying across the differing disciplines and doing it in a standardized taxonomy about what information we would like to collect. There's another interagency working group now that's thinking about the integration of the science and technology with the disaster response and thinking about these two things together. Let's go to the next slide, please. So this One Health framework response, which is currently evolving, is using common things across all networks, thinking about the different disciplines, physical science, economics, social science, et cetera, and thinking about the differing overlaps within those things, the characterization, the mitigation strategies, the treatments, et cetera, that would be applicable, and trying to parse and identify all the questions from differing sectors and to begin to put those together in a way that the information can be collected more effectively and strategically. Let's go to the next slide, please. At the NIH, we've been building a program since 2014 to try to not only think about what is the information we need to collect, but how do we implement that more effectively? How can we not only identify the research and identify that platform for where we can exchange transdisciplinary questions, but then begin to implement it more fastidiously and effectively across the United States and then with global partners. Typically, we've identified, and this has been an ongoing effort with the national academies to identify the challenge areas, about the process challenges, about the infrastructure challenges, about challenges in effective engagement, and challenges in effective integration with the emergency management and response systems. We find that there's been difficulty in formal ways to coordinate research, the funding of the research, slow reviews for IRB, ethical challenges, lack of ready-to-go tools and protocols, lack of trained researchers, lack of inclusion of community stakeholders, and typically the inclusiveness of the exposure data, which is functional for human, scientific, and epidemiologic research, is not well integrated, if available at all. Let me switch to the next slide. So we've been working on a program to increase the speed and quality of epidemiological and clinical research and promote standardized measures, replication, and cross comparisons. One thing that we've begun to do is created a new platform or website with our partners at the National Library of Medicine. And this was just to create the survey tools and create a home for survey tools and research data collection instruments across differing types of disasters. And of course, this is now the home base for the COVID collection, which has over 100 COVID related surveys from across the world, predominantly with US ones, that can be used by the research community to more effectively understand and look at the way the questions and information is being collected in different countries or in different disciplines, and then to be able to use those approaches and to do that more systematically and coordinated across different study designs. Also, training materials and workshops has been part of it, and I'll come back to that in just a moment. And also creating a larger scale community of practice. We at NIH, our partners are our academic partners across the United States and globally. Our others have their different partners. So thinking about who are your partners and how can we bring them into this fold and do something more collegial and applied in this space. So we've been working with our federal partners, our academic centers across the United States, community workers and stakeholders as part of our extramural research funding efforts. And then we now have MOUs with Japan and Canada to develop this model of disaster research response that, that we've been trying to develop. Let me go to the next slide, please. So in terms of trying to implement this, and this is kind of where the rubber meets the road. So thinking about what questions do we wish to answer? How can we begin to implement this in terms of creating tools and resources? One thing that we did develop was a protocol that we called RAPID, that was a large-scale protocol that had all the different kinds of areas in it. If you wanted to collect epidemiologic information on different systems or health events, that was in there, collecting medical testing information, collecting information on the environment, etc. We created a large-scale protocol along with these different survey instruments. And we've been having workshops with partners across the United States since 2014. And these workshops would bring in state and local entities, industry, community members, emergency management, and we would take scenarios and we would focus on not on the emergency management, but we'd focus on the data collection for an event. And then these events, we would spend time and energy to talk through about who can collect what, how do we answer the various questions together, and bringing the academic centers with our public health entities and our clinical research groups together to discuss this. And these events have actually, these workshops have actually translated now into real world opportunities to collect information effectively. So using these IRB pre-approved protocols and tools from the websites, leveraging pre-existing relationships and partnering with health agencies, and forming rapid research collaborations locally and within the US, we were able to, local groups were able to respond to Hurricane Harvey rapidly by collecting sampling, soil, water, wristbands on health populations. Excuse me. GIS mapping and data mapping and rapid health registries of the community. In response to the COVID, we had done a workshop in Tucson in 2019 related to a chemical spill, but they were able to take that infrastructure and translate it to the COVID response by using multi-departments across the university with health departments to be able to stand up larger scale human health population research related to COVID. So it's really a nice model that's beginning to give us dividends now in terms of translating not only what are the research questions from a multidisciplinary, multi-transparent, kind of corporal effort into actual implementation. And next, I'd like to talk a little bit about translation. Next slide, please. So in terms of translation, we have a program which thinks about how do we begin to translate the research to communities. And this particular thing, an aspect is our translation to workers situation. We have a program at NIH within our institute that has a network of nonprofit organizations throughout the United States that's focused on protecting workers and communities and taking information and translating that. It delivers health and safety information, high quality curricula using appropriate language, cultural and literacy considerations within that context, and then taking that forward. So the next slide, please. So what they use is essentially the One Health science to translate it to an all hazards approach. So essentially they're taking our information, thinking through it from what's generated from CDC, from NIH, from OSHA, and then developing training courses, provide worker training, community members with knowledge and skills to prevent and protect against and respond to various hazards and exposures. And they've applied this to the anthrax attacks, H1N1, mold remediation, Ebola virus, and now the COVID-19, and be able to rapidly translate the science to our communities and to our workers more effectively to be able to actually get it into the field, and it stood up. And lastly, they've done a climate change vulnerability assessment as well, and that's now identified the different types of questions that we need to be able to answer more collectively. And then finally, last slide. Really providing the evidence base for improved preparedness, response, and recovery. So from our perspective, it's really about this translation to establishing the common frameworks to drive data collection, to building a global community of practice with the expertise and skills and shared resources, the empowering the data collection through strategies like our DR2, the implementation and reporting guidelines with communities, to training of the diverse stakeholders through curricula and exercises or centers of excellence that we could begin to actually implement it, and then the translation, some of the examples I gave of the public health practice, mitigation, treatment, resilience, and sustainability. And thank you very much.
Dr. Miller, thank you so much. And the presentation will be available as part of the recordings on the ICMR website when we put them up together. For those of you that still have the opportunity to ask questions, the chat box is open, even though we are 20 minutes behind time. Just want to kind of make that known to all of us. It's my privilege to welcome Professor Dr. M.D. Gupte, the former director of the ICMR National Institute of Epidemiology and the guest editor for the special issue of the One Health ICMR journal that was released earlier by the Honorable Minister. Dr. Gupte, the floor is yours, and I believe you do have a set of slides to be shared.
Yeah. May I have the first slide?
1 second, sir.
Honorable Minister, Shri Harshvardhan Ji, Professor Vijay Raghavan, Dr. Balram Bhargav, and all the distinguished participants. It's my great privilege to participate in this important international symposium. At the outset, let me thank you for giving me this opportunity to be the guest editor for this important special issue of ICMR. I'll be failing in my duty if I do not put on record my sincere thanks to all the collaborators for this issue and also the editorial team that we had at ICMR to support all these activities for developing this special issue in record time. May I go to the next slide, please? To start with, I would like to refer to two important events. The first, from Charak Samhita, Loka Purusha Samasiddhanta, or Purushoyam Loka Samhitaha. Now, this means essentially that Purusha, which reflects all living beings, and Loka is the universe. This is in unison. And you'll be surprised to see that after 3,000 years, we do find the echo of the same particular statement from no less than a person than Dr. Dasagupta, Professor Dasgupta, Sir Partha Dasagupta, in February 2021. He states, our livelihoods and well-being all depend on our most precious asset, nature. We are part of nature and not separate from it. Understanding of this oneness and their dependence on each other helps avoiding harmful actions of humankind to the environment in the present era of Anthropocene. Next slide, please. I'm going to run through quickly because I heard from Dr. John that we are running behind the time, and I would like to see that I don't repeat the same issues which were reflected already by several speakers before me. But India is a special hot zone for zoonosis. And the reason for that, we have 2.4% of world surface area, and we sustain about 1/6 of the total population of the globe, about 17.5%. If you look at various endemics, we have got several endemics which are ongoing and keep on coming up over and over again. We have epidemics like Kayasur forest disease, Crimean Congo hemorrhagic fever, Nipah, scrub typhus, and so on. And then on top of it, we keep on facing the pandemics like plague, like Spanish flu, and the present COVID-19. Our focus when it comes to One Health, unfortunately, happens to be only on the pandemics, and we keep aside the endemics and epidemics, which also are truly part of the One Health situation. If you look at what we have been doing in India, in 2015, we started talking of India's commitment to end outbreaks of emerging infectious diseases, AID, within a decade's time. That is 2025, that is 4 years from now. Do you think we can ever achieve this thing? We have learned great messages, and therefore we have to go through to international health regulations change in 2005. If we commit the same mistake that we are going to overcome all these epidemics in a short span of 4 years, it's never going to happen. Further, the National Health Policy document, which was released in 2017, neither mentioned zoonosis nor emerging infectious diseases. So we have got hardly a few years through which we have to run through all these things. Next slide, please. If you look at India One Health Summit, several things we have been doing in India over the last few years, from 2018 onwards, and they are coming as sporadic events. We have got several meetings ongoing one after the other, but to really put forth all these things together, if you look at the last point, annual budget Government of India of 1st February 2021 announced the establishment of National Institute of One Health. And our Honorable Minister today did echo the same feeling that at Nagpur, this National Institute of One Health is going to be established. We have been spearheading this particular activity for the last decade. We started our efforts from ICMR from 2009-10 along with the ICAR. And it's very heartening to see that when I was chairing several of these sessions over the several years in the past, now we are coming to the fruition of this activity. And this new institute under ICMR will come up very shortly. Next slide. Next slide, please. If you look at the Indian scenario, the National Health Policy of 2017, as I mentioned, hardly ever mentions intersectoral approach and is silent on One Health as well. The institute that we have got at Bangalore, Nivedi, has a role on animal disease surveillance, but surveillance is not efficient. The wildlife disease surveillance exists only as a concept. If I talk of IDSP, the linkages that we want to have between animal disease surveillance and human disease surveillance is hardly existing today. We are making efforts. We should bring it really efficient and effective in time to come. The scoping review that we did recently documents very low research interest in One Health, and the first paper from India came up only in 2011. There were hardly 34-35 papers on One Health before the COVID-19 situation. If you look at the policy framework that needs to be created, there is nothing existing today, and we need to have paradigm shift in the approach, and it calls for policy analysis and research. Next slide. Next slide, please. The One Health focus, the focus of One Health approach, as I mentioned initially, is on emerging and researching infectious diseases in the global context. But apart from that, we have to look at several other problems that we have got in our country as well as in the globe as a whole. Even the origin of One Health advocacy happened to be from Ebola in Central Africa in 2003 and the fake epidemics of Ebola in 2014-18. It certainly helps us to understand, act, and possibly avert similar situations in India and the world in general. But if we start looking at only these situations and ignore the existing problems over the period of time in the so-called peace period, I think we are going to commit a very big mistake. Next slide. Next slide, please. If we start looking for the way forward beyond emerging and researching infectious diseases, historically, we have been responding to human civilizations to outbreaks, and our response has been highly reactive. We also have seen that once the threat disappeared, the response also vanished. This epidemic amnesia is a global phenomenon and can be traced over centuries all over the world. Now, we need to have proof of principle that One Health really works. There is no proof of principle as of today. We have been talking in several fora, including the tripartite agreement, including our various meetings at the global level. But we need to establish and need to show that this One Health approach really works by collaborating, by breaking the silos which we have been facing so far. Advocacy for collaborative and communicative trans-sectoral approach is a must. Creation of political will and policy framework will only establish this particular activity in time to come. As Dr. Reddy Swarup mentioned, we don't need COVID-19 situation over and over again. We want to see that even during the peacetime, we keep on working towards One Health. And the institute that we are going to establish at Nagpur will facilitate our coming together in time to come. Thank you very much.
Thank you, Dr. Gupte, for the response that you've given and for the course of action that we need to undertake from our perspective here from India. We have a set of remarks that are coming in, and I will just name the people that are going to be coming on one after the other. We have Dr. B.M. Tripathi, DDG from the Indian Council for Agricultural Research. We have Dr. Sajid Kumar Singh, Director, NCDC, and we have Mr. Kamal Kishore, member of the National Disaster Management Agency, one after the other. May I invite Dr. B.M. Tripathi, please?
Thank you, sir. Am I audible?
Yes, sir.
Okay. So thank you very much for giving this opportunity. Well, very honorable Union Minister of Health and Family Welfare, Dr. Harshvardhan Ji, respected representative by the Government of India, Dr. Vendra Ji, all esteemed secretaries from various departments, Thank you very much for giving this opportunity. Very good evening to all of you. Much has been said about the One Health. So my here job is that to give the core competency that we have in ICR system. Just to start with, One Health recognizes that health of the people is closely connected to the health of animals and our shared environment. One Health was one initiated as a concept and the latter as an approach. Now, in the recent time, it has been accepted as a priority. Now we should take it as a movement in the country. For us, One Health is not a new concept, and I would like to simply, in a couple of seconds, to exemplify. The best example is the Bacillus and the BCG vaccine that was developed by Calmette and Albert Calmette was a French physician and a bacteriologist and immunologist, whereas Gorin was a veterinarian and he was a veterinary bacteriologist and immunologist. And they developed this vaccine from animal pathogen Mycobacterium bovis. So this is what about 100 years back, and now still, and we are knowing the market this day. So One Health development, our core competencies of is, as our DG has said very clearly, that veterinary public health itself we have got a grant of on the veterinary medicine, and it is in our curriculum in the veterinary colleges and also our deemed university like IVRI. And every year, almost 100 postgraduate students trained in veterinary public health solely devoted to the zoonotic diseases. They read and they are our core competency in the veterinary side itself. And IVRI itself, from after 1985, they produced over 120 postgraduate students trained in veterinary public health. So we are dealing and contribute to the One Health perspective. So coming out to the ICR Institute as such, we have got 4 or 5 animal health institutes under animal science, and that has been working within the One Health perspective. We have got Indian Veterinary Research Institute of ICMR, in addition to providing PhD education in VPS, we are also working on many diseases like rabies, like Japanese encephalitis, and brucellosis, and leptospirosis, mycobacterial tuberculosis, paratuberculosis, and so on and so forth. We have also got a biosafety facility at IVRI where we are testing COVID samples also. We have another laboratory, very good circle laboratory, the high security animal disease laboratory at Bhopal, where we deal with avian influenza-like pathogen. It is a BSC plus. It was earlier BSL-4 lab during 2000, but with the passage of time and the change in the standard, then it has become now BSL-3. And there we handle a lot of many diseases and so many zoonotic diseases like CCHF, like Nipah Ebola virus, and MERS coronavirus, SARS coronavirus, and COVID virus, and of course KFD also. Where we have developed our own competency in terms of RT-PCR and real-time PCR. Similarly, we have developed there at NSR campus consensus assay for pan family and genus-wise molecular test for 12 viral families. That includes many viruses like Esto, Arena, Corona, Figo, etc. And then again, pan gene-wise consensus RT-PCR and PCR for 8 viral genus specific like obivirus, sulfavirus, flavivirus, and so on and so forth. So, and then we are also working on prioritized, now we have started working on prioritized high-risk zoonotic pathogens screening like Nipah, CCHF, Ebola, MERS corona, and SARS coronavirus. And also we are going for the surveillance of tick population for viruses of zoonotic importance like narrow sheep disease, KFD, and tick-borne encephalitis. And the surveillance of bat population of high-risk zoonotic diseases like coronaviruses, filoviruses, and hantaviruses, etc. At our Nivedi campus, we have got a National Institute for Epidemiology and Informatics. So where also we are dealing with a lot of the zoonotic diseases in terms of Japanese encephalitis, brucellosis, anthrax, leptospirosis, cysticercosis, and also antimicrobial resistance. And we have developed there at a NADRES system, National Animal Disease Referral Expert System, where we forecast also include some of the zoonotic diseases like anthrax, where we forecast disease about 2-3 months before the occurrence and from throughout the country. Now we are also changing it as a version 2 using artificial intelligence and machine learning also to that. And so this laboratory also working on zoonotic diseases. Another institute we have got National Research Center on Equines that is also working on the like human glanders and other Japanese encephalitis, developing with the other vaccine development and also diagnostic development. We have a veterinary type culture at ICMR where we are maintaining more than 4,000 veterinary and genetic pathogens, which includes about 350 viruses registered from 25 families. And at our IC International Center for FMD, we have got another BSLT laboratory. So these infrastructure facility, in terms of these, we have got BSL2, BSL3 facility in 5 institutes. Now, coming to the very specific network program and outreach program on zoonotic and zoonotic diseases that we had a zoonotic disease on for last 10 years. We've been working on around 20 diseases, bacterial, viral, zoonotic diseases. Then having a key center throughout the country. We're working also on the exotic disease and zoonotic and different ERCRP and pesticide residues, and also drug rescue and environmental pollutant at a food safety point of view. AMR, antimicrobial resistant, as such, we have been working through our 25 centers, animal and fisheries center in collaboration with FAO. And one of the important things that we have started working 3 years in collaboration with NCDC for an intersectoral coordination program on One Health, and where they have set up regional coordinating centers where we are actively participating, almost 50% labs for the veterinary and for the medical, which they are going to have almost 30 regional coordinators. So that's also a whole lot of things that we've been working. We have got in the country, the Central Disease Diagnostic Laboratory that is coordinating other regional laboratories run by the Government of India. Now also we have been working on COVID diagnosis services that we are providing currently. Almost more than 5 lakh samples have been tested at our 5 locations serving a research facility. And then we have also working on some COVID research also. As our earlier speaker has said that last 20 years, we have got 2 viruses. They are really creative havoc. One is the influenza virus and there is the coronavirus. 3-4 viruses have evolved in the period. So we are working on the coronaviruses at animal, human, and wildlife interface. We're also doing for diagnostics for the animals, and also working on the vaccine platform, especially mRNA vaccine, a field vaccine, and also vector vaccine. We have got our own vector. So very soon within these 6 to 9 months, we are going to have this and share here with you for the general purpose and use of human if possible. We are also working on some antiviral research also, and I would like to share with you that we have got one FDA approved drug that's called Amitin, and it has been found to be 100% effective against coronavirus. And the paper has been also published in antiviral research. And I wish that if DG ICMR will take note of it and can he really go for the clinical trial, it will be better than. And it is not going to have developed any resistance in that, because this mechanism of action of this Amitin is host-directed antiviral therapy. So it will be a very good medicine that we have to try it. Then again, I would like to suggest one thing, that herbal drugs, we have been talking about herbal drugs a lot. I mean, coronil and ashwagandha and nigella, so on and so forth. But we never tried to prove it, their antiviral capacity. And then also we have never tried to see whether they are really immunoenhancer, immunostimulators. So why not we should take some research on such like drugs that can be effective and can be prescribed by the medical doctors also. So with this, I would like to suggest certain things, that there will be a central command to look after this One Health problem, and there will be a close collaboration between ICMR and ICR with other health departments and the environment department to work with, and then we can also work with the health department about the national, I mean the disease expert referral system to develop an integrated system where zoonotic diseases can really go out that. And more strategic and research on the influenza and coronavirus, that will have to be done by this country anyway. So with this, I really thank you very much for having given this opportunity to speak. Thank you very much.
Thank you, Dr. Tripathi. Dr. Sujit Kumar from NCDC. We have extended the time by 15 minutes. We need to close by 7:15, so let's be mindful of time, please. Dr. Sujit Kumar, thank you.
Thank you very much, and a very good evening to all the dignitaries who are present. At the outset, I must express my congratulations and regards to Honorable DG ICMR, Sri Balram Bhargava sir, our Honorable Minister, Dr. Harshvardhan, for taking this important initiative in the field of public One Health. I think this is a very, very pertinent subject, and the mere presence of so many dignitaries, so many secretaries across various sectors by itself underscores or underlines the importance of this particular One Health approach. Having said that, the highest level key stakeholders which are present in this meeting, I think will definitely take this particular initiative beyond the symposium which is being organized at an international, where international experts and the national experts are coming together to discuss some of the important strategic priorities. I think the sessions have been very well conceptualized, right from global perspective to strategic initiatives in preparedness, and then going down to the country-specific One Health initiatives and responses. I think from Indian perspective, it is really very important and very pertinent, both from, because as per international health regulations, the One Health approach is the one which has to be focused to meet with all hazards approach, which is underlined in the international health regulations, to deal with the events not only with regard to the biological agents, but also chemical, radionuclear, and other agents as well. So One Health, that is intersectoral coordination between the various sectors, is very, very important. Second important aspect I would like to highlight is the surveillance. I think it has been mentioned by Dr. Gupte in his address, and this requires to be a coordinated surveillance between various sectors. Here the surveillance in animal sector, wildlife sector, human sector, and of course the other sectors are also very important when it comes to detecting the early warning signs, which are the key or which are the guiding force for having a proactive approach. I think till now, approach which we have been following in the dealing with the important zoonotic infections like CCHF, like Zika, like SARS-1, and then with the H1N1 and Ebola, avian influenza, and so on and so forth, has been more of a reactive nature. I think in Nipah virus, what we have seen is, yes, every sector came together. Wildlife also came together. But in the beginning, when we started looking at the outbreak and dealing with the outbreak, we realized that this particular specialty is with the wildlife sector, not with the animal husbandry sector. So I think that clearly highlighted that how important is the coordination between the various sectors, not only as a person-to-person coordination, but also the surveillance systems in each sector needs to talk to each other, so that when regular meetings between the surveillance officers of each sector will happen, then definitely they will give us some important early warning signals. And this becomes very important as far as KFD is concerned, where early monkey death points gives a pointer to detecting the movement of the infection from one area to another. Similarly, the like CCHF, I think ICMR has and NCDC are coordinating in a big way, where the animal sector surveillance is being coordinated by ICMR, and when they find something important, that is being shared with NCDC to deal with the disease outbreak, particularly with regard to monitoring the CCHF case in human beings. Similarly, avian influenza, I think that is one sector where all the sector agencies have come together since 2007. And we have a very, very effective surveillance mechanism, well-planned strategy where we are monitoring the human sector, animal sector is monitoring animal sector. And till now, because of our effective surveillance and effective containment measures, no human case has been detected in the country so far. That underlines the importance of coordinating between various sectors so that we don't face such kind of spillover of the infection from animal to the human sector. I think second important aspect will be the laboratory surveillance. I think laboratory sectors in each human, animal, and wildlife sector needs to come together, so that whatever early signs are indicated from the lab, I think that should be giving some kind of indication to strengthen particular response mechanism or particular coordination between various sectors. So laboratory sector surveillance is also very important. I would like to name two important aspects. Number one is the climate change. I think climate change has been underlined very nicely, and we are coordinating as a national agency with the Ministry of Environment and Chemical, the climatic changes. So with that, air pollution and heat-related illnesses and many other illnesses, where all the sectors are coming together to identify not only the airborne priorities or emergencies, but also with regard to change which is impacting the occurrence of these diseases. Another aspect is the AMR. I would like to highlight, as has been highlighted by previous speaker, antimicrobial resistance is going to be the problem of future. And I think it has been very well conceptualized by the country by formulating a intersectorial, multidisciplinary plan, National AMR Containment Plan. So in that, the roles and responsibilities have been clearly earmarked, but yes, we have to go a long way, and we have to rationalize not only antibiotic use among human, animal, pharmacy sector, but also across the food sector and agriculture sector as well. So I think these are some of the few initiatives which have been taken in various sectors, but yes, road is definitely long, and definitely it requires dedicated effort, not only with regard to the surveillance, but also with regard to coordinating research and the laboratory strengthening for capacity building in these sectors. So I think with these words, I thank the organizers for giving me the opportunity to highlight some of the priorities, and thank you very much to all.
Dr. Singh, thank you so much for all the points that you were able to pack in such a short time. May I invite Mr. Kamal Kishore, member of the National Disaster Management Agency, to also put forth his perspective.
Thank you very much. I just have 3 points to make. The first point I want to make is that those of us who work on disasters, we've abandoned the use of term natural disasters. There are no natural disasters, they're all man-made. There may be hazards that are natural. An earthquake may be natural, but when it kills people, there is nothing natural about it. It happens because we live in earthquake-prone areas and we build weak buildings. And that applies to all disasters. There are no natural disasters, they're all man-made disasters. Now, coming to the issues of health and One Health, I just want to highlight 3 things that those of us who work on risk, basically we work on extreme events, are focusing on in the country. Number one, a lot of work in the last 5, 6 years, 7 years maybe, on looking at asset level risk management, guidelines on hospital safety in terms of structural safety, non-structural safety, and so on. The second is standard operating procedures after disasters. How do you manage a large caseload of injured people? How do you manage dead bodies? How do you prevent secondary order health impacts after floods so that cholera incidents do not happen, and so on? So that's the second piece of work that's happening. The third, where we are taking nebulous, very initial steps, is really looking at epidemiology of different disasters. We want to be able to predict, you have an earthquake and you should be able to predict what is the kind of caseload you're going to see in terms of what kind of injuries. All of that is entirely predictable if we have good vulnerability functions from past events, what kind of buildings collapse in what way for different magnitudes and intensities of earthquakes, and what is the proportion of different kinds of injuries. So on the, we have pretty good understanding of epidemiology of heat waves, for example, and floods. We need to do a lot better for the others. So with these 3 different buckets of work, what we have realized over a period of time is that there is no use in really looking at risk at the level of assets, at the level of capital assets or human assets. Risk is really systemic. For all disasters, when power fails, telecom fails. When telecom fails, manufacturing fails. Health facilities have a challenge. So the effects really ripple across the system. So it's really important that we take a systemic approach to disaster risk management, as opposed to reducing risk and vulnerability at the level of assets. And in that context, what is being proposed through a One Health approach really fits right in. And from the disaster risk management community, we would be very excited to collaborate with this community of practitioners and see how we can learn from that and build our collective resilience. Thank you very much.
Mr. Kishore, thank you so much for such a succinct presentation of stratifying both the risk and the cascade of vulnerability that we need to address ourselves to. We close with a double act. Somebody who is familiar with our One Health conversations in India, Professor Vivek Kapoor from the University of Pennsylvania College of Agriculture, and we have the chair of the One Health Commission, Cheryl Stroud. She was able to also join in. So Vivek and Cheryl, the floor is yours.
Great, thank you very much. Distinguished Minister, colleagues, thanks very much for inviting us. It's a pleasure for us to participate. My colleague, Cheryl Stroud, and I would try and share with you a tag team of some information that we have of relevance to this audience. In brief, the important components that we will be going through. Are you able to see my slides okay?
Go ahead.
Okay, great, excellent. So we're going to lay out whatever we've been doing, particularly from the global, regional, national, state, and local levels, and we're going to try and give an overview, particularly of some local programs that are being implemented. We're going to try and do this all in the next 5 minutes or less, so please hang on to your seat. Cheryl?
Yes, Vivek, you might want to put the screen to full screen mode so that we can see more of the slides. Just as background, the One Health Commission is a globally focused nonprofit organization that works to raise awareness and educate all audiences about implementing One Health. Next slide, Vivek. It does this by connecting One Health advocates and stakeholders to create global teams and networks that can work together to educate about One Health. The Commission is the largest collection of One Health advocates and networks in the world. Next slide. The Commission creates and distributes a monthly One Health Happenings newsletter that highlights news and events about One Health implementation around the world. This newsletter goes to over 15,000 global One Health advocates and gets forwarded much more deeply into many other networks. Next slide. We keep an eye on what is going on around the world and may help make the world aware of significant One Health happenings at local, regional, and international levels. Next slide. We helped create in 2016 a Global One Health Day that is officially celebrated on November 3. Many of you will be familiar with it. And we also lead a Global One Health Awareness Month each January that really help the world understand the full scope of One Health beyond zoonotic diseases. Next slide. One current project is to identify and compile links to national One Health strategic plans around the world. This ugly slide will eventually turn into a web page where the world can see all the things going on for One Health around the world. Next slide. I would really like to make sure that you leaders, One Health leaders there in India, are familiar with the outbreak exhibit that the Smithsonian Institute in the US created. There is a free traveling version of this exhibit that you could bring to many, many regions across India to help educate the public about the One Health concept relative to zoonotic diseases. And I'd be happy to connect you guys with the Smithsonian to set that up. Next slide. I just want to remind us that no one profession, no one discipline, no one agency can know everything or can implement One Health alone. We really have to reach out and work together. And I'd just like to reiterate what I've heard in this meeting today. Having these networks in place allows us a mechanism to share best practices, best One Health practices, and can help us build a One Health framed workforce capacity. And then just to remind us one more time that the collaborations that we have to have in place to do this are built on trust, relationships, and trust. And that sharing will require not only our sharing of knowledge, but also our sharing of resources. So with those few quick comments, I thank you for the opportunity to be here with you today, and I turn it back to Vivek.
Great, thank you much, Cheryl. In India as well, there's actually been considerable progress. The Secretary DPT, Dr. Renu Swarup, and others have mentioned the One Health conference in India, in New Delhi in 2019. That actually came up with a declaration which provided sort of a roadmap. And that roadmap included, for those of you who wish to go and look at the onehealthindia.org website, has that declaration. But part of that was to actually build something in terms of regional networks. And so there is a new activity set up by Drs. Rao and Professors Vanderhorst and Sachin Chaturvedi, with participation from diverse stakeholders, including many of those who are here, to try and build this network for a global alliance, if you will, for pandemic preparedness and response. But the focus of this particular alliance is really around South-South relationship and South-South collaborations. The intent is to try and build resilience. We've heard that word a couple of times in terms of transdisciplinary collaboration and health and biosecurity, and building these dialogues along with other supranational organizations. An important component of this is to actually manage exactly what's going to happen at various levels. And so there are multiple stakeholders at each of these levels, the global, the regional, the national, and subnational levels, which are really important to manage. And those engagements are being mapped out and hopefully will be facilitated, particularly with relevance to South-South collaboration. There's a pretty large list of collaborators that are already forming. And I think this is, again, an example of how it's possible for us to be able to, from India at least, start to lead the way, and particularly in the global South, how we might be able to lead the way in One Health. I'd encourage those of you interested to visit the apar.web site or contact my colleagues, Dr. Rao, Vanderhorst, Chaturvedi. One of the things, though, that's important is that while we've been talking about these global networks and grand challenges, action must be local. And in fact, the fruit of the pudding really comes not necessarily with central support, which is absolutely necessary and critical, but it's not sufficient. And so specific programs and long-term investments are needed to build all of those things that lead to, we've heard this before, the intersectoral trust. And investments in capabilities, the people, processes, shared accountability systems, as well as the evidence base to deal with future and current big grand challenges. We have a strategy map, and I'd encourage those of you who'd be interested in looking at this in the declaration in 2019, and it's very consistent with the strategy map that the CDC and other organizations have laid out as well. And this was developed in particular for our situation in India. So I'd encourage you to take a look at this. Overall, though, there's examples that I think we might be able to share. For example, our work on TB that Dr. Swarup and others have mentioned is being done in collaboration with colleagues within the ICR system, the ICMR system, and also with academic partners. For instance, TB, a wonderful example, horrible example, in fact, where you cannot, where it's pretty clear we can't eliminate human TB without controlling bovine TB. And if our ambitious plan to eliminate TB by 2025 laid out by the Prime Minister is going to be realized, we have to be able to do something about this. So we're working very closely with a large group of stakeholders, and this is together with the Department of Biotechnology and funding from the Bill and Melinda Gates Foundation, and to try and address this. And the good news is that progress has already been made. In fact, we have the opportunity to make this into a fairly robust framework that can be followed by the rest of the world. But again, India leading the way. Not only on TB on the cattle or animal side, but also on the human side, we've been working with, again, with a diverse set of stakeholders across the country, including CMC Vellore, MGIMS, AIMS, NIRT and others, along with the ICR system, IVRI in particular, Nivedi and others. Again, a very good example where we can try and build capabilities to address what is a unique problem within the country. We've already made dramatic progress, and I'd encourage those of you who are interested to contact me or participate in this in this activity. I'm very happy to include you. We've also similarly starting out, again, these thinking global but acting local programs, another initiative on anthrax, which we're looking forward to be working again with partners within the ICMR, ICAR systems, and working very closely with the ministries. Our previous work as well on TB is done in close coordination with the Central TB Division, again, part of the ministry. So working pretty closely with the ministry structures. So again, One Health, as Cheryl suggested, is all about building networks, both the internal and external. What I would say from my experience, we've had experience, and I particularly have had experience with this in multiple countries now and regions. It's critical to establish those formalized relationships and leadership structures. Without that, very little happens. It's also critical to define long-term shared objectives, and without that, again, little happens. Those action plans and investments must include investments in people, processes, technologies, as well as communications. And I'll get back to that trust word. It's critical to establish, and the only way to do that is to work collaboratively. And I'll end by saying India has an excellent opportunity to lead globally while acting locally on many problems within the country, but also serving an example of how we might together improve human, animal, and environmental health. So with that, I'll stop and take any questions. Over back to you.
Thank you, Dr. Kapoor, for the wonderful presentation that both of you were able to kind of sum up for us towards the end. It's been 145 minutes of a wonderful conversation, almost like tasting menu of all the subjects, all the highlights around One Health, the needs, the opportunities, and the challenges that are there for us to kind of build together, overcome, and walk alongside with each other. We can't do trust building during times of crisis. They need to be done when there's peace. And that's something that I would like to underscore for each of us that's been there for the last 145 minutes. We also need to build up our collaborations, build up trust, build up our capacities by sharing with whatever we have, and build together for shared and valuable outcomes. That's really what One Health really means, bringing together human health, animal health, environmental influences all together, approaching each of them and making sure that we do have better survival for each one of us. We went a little bit over time, but I think it's been worth it. Thank you for all of you who stayed with us. I especially want to thank Professor Bhargav and the team at the ICMR for having encouraged, pushed, and supported the putting together of this One Health event, and also of the specialty of the ICMR, which by itself also has a wonderful wealth of new information and collation of things that have been done so far. We look forward to keeping in touch with each of you. For many of you who have made your comments on the chat box and otherwise directly in, we will be in touch. The edited version of this symposium will be available on the ICMR website shortly. Thank you very much and have a very good evening, good day, wherever you are.
Dr. Kapoor, how are you?